Okay, everyone, so we might start. I'd like to welcome Robert Bartholomew to our first online Zoom health psychology seminar series. Robert has a really interesting and varied background. He's been a journalist, he's been a librarian, he's a medical sociologist, and he's also a history teacher at Botany College, and has told me that he has never done any kind of formal qualification in history or psychology. So obviously a man of many talents, and we have to apply the knowledge that he learns into different roles. Robert's also new to Zoom, so he's been very proficient this morning and not had any problems. So hopefully our technology holds up home and shows him an easy platform it is to use. Robert's also said he's happy to take questions along the way. However, if you would like to enter those into the chat section, then we can keep an eye on those and answer those as we go, and have some time at the end to be able to tidy things up and answer any further questions that you might have. So without any further ado, I'm going to hand over to Robert to begin his talk.
Look, thank you, and thank you for taking the time to be here with me today. I want to try to make this... Yep. Can everybody hear me okay? I want to try to make this, is that good? Make this interesting and exciting, and kind of move right along as we're going. And so Lisa, is that good? Everybody can hear me okay?
Yep, we can hear you
okay.
Fine. I'm just moving as we go.
Yep. And I was just mentioning to Dr. Duncan that this morning I was teaching a year 9 class in Botany College, and you do what you have to do to keep the students' interest. Tommy here is my little prop that I use for the year 9s. I won't use Tommy here at the university level. But anyway, look, I'm an outsider to the field of health psychology. And I'm wondering why my PowerPoint isn't moving. I pressed the button. So maybe I'm going to do this. So I've hit the power. Sorry about that. I'm trying to move my PowerPoint and it doesn't seem to be moving.
You might have to go back into the, there we go.
There we go. Okay. Is that, yeah, all right. So let me, all right. This picture might capture the mood of some people today or during the lockdown. So look, I'm an outsider to the field of health psychology. And what makes this so attractive and interesting to me, I think, is the human condition. Most people who visit doctors present with medically unexplained symptoms. Things like fatigue, chronic pain, dizziness, headache, ambiguous stomach pain and sensations. Most doctors do very little to treat these symptoms. They follow the oath of do no harm. And for me, I found this very interesting. A 2014 study by Keith Petrie and his colleagues that was conducted with a national phone survey. And they found back in 2014 that the median number of symptoms experienced in the previous week was 5. And about a quarter had 10 or more symptoms. 90% of all of those surveyed had symptoms. And there appears to be an increased somatic awareness today, an increased somatic awareness of, I'm sure you can see me there, compared to the past. To quote neurologist Bob Ballo, who I've worked with, modern day people believe that they are sick on a regular basis. And of course, there's a common term for this. People like Simon Wesley would refer to these people as the worried well. Historian Edward Shorter has observed that when Americans were surveyed as to how many episodes of illness they had experienced over the past few months, those polled in the 1920s reported 82 bouts of illness per 100 people. A more contemporary poll found 212 episodes per 100 people. Now, there's all kinds of issues you can raise with the way the surveys were done and things like that, but it's quite interesting. As an outsider looking into health psychology, I think that much of health psychology centers around the fact that humans are very fragile, we're very fallible, and we're very prone to self-deception. We're prone to seeing things that are not there. We're prone to believing things that are not true. You just have to look at America these days. And we're prone to remembering things that never happened. It's the power of belief, and it's the power of framing. And when I think of this, I think of the Nietzsche book title, Human, All Too Human. And this becomes the backdrop for the stage of so many dramas that involve mass psychogenic illness. And I'll give you an example in a minute here, but it also involves the search for meaning. Human beings seek meaning, we look for patterns, and we often create meaning where none exist. And I'll give you a visual example. This woman in the picture is Maria Rubio. It was taken back in 1977. She's a devout Catholic, and she burned a tortilla while cooking and became convinced it was the face of Jesus. Tens of thousands of people flocked to her home to see what many believed was a miracle. This happened for many decades. She had all these people coming to her homes, and it just shows how people are prone to seeing what we expect to see and how that is framed by our backgrounds. Now, when I look at that, I don't see the face of Jesus. It looks more to me like Katy Perry, really, to be honest. And to give another example, this is American astronomer Percival Lowell. In 1894, he peered through his telescope and mapped out a complex system of canals on Mars that he thought were proof of intelligent life. That is his complex canal system. And this is what was actually there. One more example is the face on Mars. There's a close-up. And you can see back in the 70s where people thought they saw this face, and then over time, the sands had shifted. But human beings were meaning-oriented creatures, and we often create meaning out of nothing. Now, let me give you an example of the power of framing. So this creation of meaning happens with all our senses. In 1898, H.G. Wells wrote his book, The War of the Worlds. It's a story about a Martian invasion of Earth. On Halloween Eve in 1938, Orson Welles, who's no relation, presented a radio play based on the book, which triggered short-term fear in the New York, New Jersey area, where a number of people actually believed that they were under attack by Martians. Now, the radio play, what's so interesting about this is it described Martians fire heat rays. It described Martians firing poison gas. Some listeners actually phoned police to report that they could feel the heat rays that were being described on the radio. Others shoved rags under their doors and in keyholes and reported choking and having difficulty breathing because of the poison gas that they believed that they were perceiving. Our sense of smell can also deceive us. These Afghan schoolgirls quickly recovered after initially believing they had been sprayed with poison gas. The rumor was that the Taliban had sprayed them, their school, with this poisonous gas, but in reality, it was an odor, I believe it was caused by someone cooking. Sound as well has been known to trigger outbreaks of mass psychogenic illness. In the mid-1700s, Benjamin Franklin invented a high-pitched instrument known as the glass harmonica. When it first appeared, it's interesting, prior to this time in the mid-1700s, people would go around America and Europe with glasses filled with water. And based on how much water was in the glasses, they would use their fingers and they could produce these high-pitched sounds in different pitches, and they would play them as you would a musical instrument. Well, he saw this and developed this glass harmonica, and by the end of the century, there were about 3,000 that had been made. And when it first appeared, it was widely believed that the glass harmonica could cure certain ailments. And many audience members reported listening to these presentations by Benjamin Franklin and others, and they reported being miraculously cured of a variety of rather mundane ailments. Now, the harmonica is played by running your fingers over this kind of turbine that spins. What's so fascinating to me is, by the late 1700s, a couple of famous glass harmonica players fell ill, out of several hundred at the time, after rumors began circulating that the harmonica was making people sick. As a result, there were many reports of people fainting and falling ill during concerts. And what's fascinating to me is the glass harmonica started out as this kind of placebo instrument, and then it turned into a nocebo. So at first it made people feel better and was causing these supposed cures, and then it was making people sick. Now, we're currently living through an extraordinary period where there are exceptionally high levels of sustained fear around the world, coupled with the spread of misinformation and ignorance. And look, all I have to do is say the word Donald Trump. I need say no more. This has rendered us vulnerable to outbreaks of mass psychogenic illness. History does not necessarily repeat itself, but it certainly rhymes. There are many historical examples where periods just like the one we're passing through now have resulted in great tragedies. While these may be dangerous and fearful times, they also present exciting opportunities for health psychologists to make a difference in the world, and specifically our department here at Auckland University. I am convinced that we are on the precipice of a series of outbreaks of mass psychogenic illness that will have major global implications. My question to you out there today is, what can we do as a health department and as health psychologists to try to mitigate what is about to happen? In the near future, there is every reason to believe that a safe and effective vaccine for COVID-19 will emerge. Probably multiple vaccines. Here's the issue that we have. There are billions of people potentially going to be vaccinated. We already have media reports questioning the safety of the Russian vaccine. There are unprecedented levels right now of government and corporate mistrust. I want to remind people, as somebody who lived through the 70s and the 60s, my memory of the 60s is a bit more vague, not because I was taking drugs, but because I was so young at the time. But we haven't always had these levels of mistrust. In the 50s in particular, I mean, there was a lot of trust in government, but particularly with the Vietnam era and onwards, there's a lot of government mistrust out there, and particularly with the internet age. And there's a lot of corporate mistrust. More and more people are giving their news on social media, unvetted. And I would describe this as a widespread global crisis of confidence. Rumors and conspiracy theories flood the internet. And we also live in this age where we don't know what to believe sometimes, and seeing isn't always believing with Photoshop and deep fakes. We also have the anti-vaccination movement. We have a system of communication where people can turn to the internet, and you can, if you're an anti-vaxxer, just find information that supports your viewpoint or racism or whatever. And that really can support confirmation bias. So there's been a number of recent surveys, some better than others. I won't go through the background of the survey, but just general surveys on the vaccine and when it's available. So Gallup did a major one recently, and they asked if the Food and Drug Administration approved a vaccine and said it was safe and effective, and it was available to you free of charge, 35% of Americans said that they would be reluctant to take such a vaccine. There's been similar studies in the UK of people who are very hesitant to take vaccines related to COVID-19. Even healthcare professionals in Israel, a significant number expressed hesitation in taking them. And there was a poll done here in New Zealand with only 605 respondents, but they suggested that there's skepticism about taking a vaccine if it became available and even if it was free. And look, this is nothing new. The World Health Organization has noted that what they call vaccine hesitancy is one of the greatest threats to global public health. That was before COVID-19. So we have this situation where we have potentially billions of people who are going to be vaccinated, and we have a lot of concern over the safety of vaccines. Now look, with the Russian vaccine, there is legitimate safety concerns, but I am talking about once a vaccine has been shown to have been safe and effective, there's still going to be considerable concern out there. And look, a vaccine could be considered a new technology, and we know there's a long history of new technologies with health scares. Kate McCrill and I are currently researching the history in this area. And of course, this department has conducted the pioneering studies on wind turbine system, a nocebo effect. When the telephone first came out, there was considerable concern that it was making people sick. And a number of telephone operators reported getting sick from the crackling noises on the phone because it was considered something that was really artificial and unnatural. The condition railway spine in the late 1800s involved people riding the train, and they reported a variety of spinal aches and pains that they attributed to riding on the train. And these have been shown over the years to have been psychogenic. in the early 1920s and 30s, AM radio was widely thought to cause people to become ill, and it was widely thought to be affecting the weather. There were cases in the early 1920s and 30s when refrigerators first started to come out, that people using ice cubes and even using food from this artificial creation was making people sick. And of course, in more recent times, there's video display terminals were widely thought to cause birth defects when they came out, mobile phones and a variety of ailments, Wi-Fi, 5G. Some of these have been linked to outbreaks of mass psychogenic illness, like the telephone, for example. Others, there's a lot of concern and fear around new technology. And so I would consider a vaccine, particularly for COVID-19, to be something of a new technology. Now, I've recently researched the literature on vaccine outbreaks and mass psychogenic illness. And over the past 25 years, there have been outbreaks in all of these different countries that were associated with vaccines and studied very thoroughly and determined to have been mass psychogenic illness. But wait, there's more. And with all of these outbreaks of mass psychogenic illness, the one that stands out to me is the one that happened in Australia back in about 2007. You had a group of Australian schoolgirls who were receiving the human papillomavirus vaccine. One of the girls fainted, and it prompted some of the other girls to faint. Here is the headline from the British Medical Journal, which to me tells you the result, and it kind of speaks for itself. Fainting schoolgirls wipe Australian $1 billion off the share value of Gardasil, which of course is the producer of the human papillomavirus vaccine. It just goes to show you the power that's out there in terms of fear. And I mean, this was right after the incident had occurred. So one aspect that has tamped down these scares and outbreaks involving mass psychogenic illness is mass psychogenic illness by proxy, where it's induced by hypervigilant parents and their relatives. So you have to think about this. The majority of vaccines that are given to infants and young children, and they often don't perceive them as a threat as adults would because they're too young. They don't understand. Yes, they understand that they've been given something that might make their arm hurt, but everything from dark circles under their eyes to common skin rashes can easily and quickly become redefined as having been caused by a result of the vaccine, which can then trigger psychogenic symptoms as well. So you've got this situation where there's a number of outbreaks of mass psychogenic illness have been triggered with vaccines in young children with mass psychogenic illness by proxy. So the children aren't reporting the symptoms initially. It's the parents who are reporting the symptoms and over-scrutinizing their children. And of course, parents are famous for over-scrutinizing every little ache and pain that a child has and then rushing them off to the doctor. Now, you've also got another scenario here triggered by anxiety. A small number of children exhibiting these illness symptoms around the inoculation, which trigger anxiety amongst themselves and then the other children. You know, we've all seen this, kids throwing tantrums, screaming at doctors' offices, and then you've got other children seeing this, and this spreads. Now, you can have a spread here from a mild allergic reaction, the actual fear itself from these children crying, and then the general anxiety. Now, these episodes are typically exacerbated once they start by initial inaccurate media reports suggesting that there's an association between the illness symptoms in a so-called bad batch of vaccine. In more media reports, the more recent ones, rumors and conspiracy theories have been exploding online and exacerbating government mistrust and coming up with theories like, well, maybe these kids are guinea pigs and they haven't fully tested it. These are very common when you look at some of the social media postings. So the mass media play a major role in these outbreaks, in exacerbating them, as they typically do with so many outbreaks of mass psychogenic illness. So when mass psychogenic illness outbreaks are triggered by vaccinations, many parents may put their lives at risk. They might put their children's life at risk, especially if they have an underlying health condition. And health psychologists, this is an area for us to potentially try to mitigate this. So here's the question that I want to throw out there. I think we're likely to see wave after wave of people claiming that the COVID-19 vaccine is making them sick when it's not making them sick. And these waves are going to be triggered by anxiety surrounding the safety of the vaccine, and they're going to be triggered by, I mean, the media is going to jump on this. We've never had a situation like this that I'm aware of where we're going to have billions of people potentially vaccinated in a relatively short period of time. With all this concern about safety and so many people being vaccinated, and not only children, but adults as well. You may have a situation where you have anti-vaxxers who are vehemently opposed to vaccinations and are afraid that they are not going to be allowed back into work. There might be stipulations. Even though you're an anti-vaxxer, you're not allowed back into your workforce and you can't make a living unless you get vaccinated. Okay, I could see some of these people compromising and saying, yep, we're going to get vaccinated, but they're going to be scrutinizing every little ache and pain. And this is a recipe to me for waves of outbreaks of mass psychogenic illness in the very near future. So I wanted to throw this out to the rest of the group here as to how can this be mitigated? What can we do as health psychologists to try? Look, I know there's been a lot of research done in trying to get people to get vaccinated and to get parents to vaccinate their children. But we're dealing with a different issue here. We got a lot of older people being vaccinated, and we've got a situation where as soon as an outbreak occurs, the media is going to jump on it. And it's so difficult to try to do pre-mitigation, right? We know that's not always going to work. We almost know for certain, in my mind, that we're going to have these outbreaks. So what's the way to respond to these when they happen? I think it's not a question of if, but when they happen. So I'm just going to stop talking now, because I get very worked up here, And I'm going to throw this out to the rest of the group. What do you think?
I have a question while people are thinking about answers with solutions, if that's okay.
Yep, sure.
So I was actually yesterday speaking to someone who's in their early 80s, and we happened to be talking about childhood memories, and he was talking about how he knew a lot of people had polio and had been affected by polio. And it seemed to be quite obvious that he was open to vaccines in a way that potentially people only just a few years younger than him weren't. And so I was wondering, given that COVID is, you know, the mortality rates and the prognosis for people who are elderly, it's quite a lot worse. I was wondering if age might be a factor that plays into people being more in need of the vaccine and maybe more open to the vaccine. What are your thoughts on that?
Yeah. I mean, this is potentially deadly, isn't it? This age group. And I think it's, I think Sergey Gupta on CNN was saying that if you're under 30, if you're over 65, you are something like 90 times more likely to die from COVID-19 than if you're 30 or under. It was some dramatic statistic like that. So that's very interesting. I mean, this is, if elderly people choose not to get vaccinated, I mean, it could potentially be a death sentence for them, isn't it? I mean, this is a life and death thing. And also, we're going to have this issue with children, just like, for example, with Jehovah's Witnesses and blood donations, right? I think there's a law up until the age of 16. I think in the United States anyway, where if you're a Jehovah's Witness, you have to get the blood transfusion, but after that age, it's up to the person to decide. But so you got a situation here where you might have babies that have health conditions that really need this vaccine, even though they're not at a super high risk, but that group would be. So people's lives are at stake here in terms of, and so when we get an outbreak, as I think inevitably is going to happen, or a series of outbreaks, it's going to undermine the trust in the government. It's going to undermine the trust in health officials that, oh, maybe there's something to this. And so I don't think I've really answered your question. I've just kind of rambled on there. But so what would you like to say?
Well, I'm just wondering where age factors in, given that the disease that we're particularly talking about, there seems to be some different narratives around age and around the dangers involved with that. Whether or not the way we target those, whether or not the way we're talking about the vaccine and psychogenic illness, whether that needs to be slightly different based on the age groups that we're talking about, because the risk is different, but also maybe openness. I mean, I don't know if there's any research on, you know, at what age group do people remember people being ill prior to vaccines, and whether or not that impacts on whether they're actually more open to it. I know quite a few elderly who are not so open to it, but used to be very open to vaccines. And I also know quite a few people that are older who seem much more open because they have seen the world prior to vaccines and they know that they don't want to go back to that. So I don't know if age is a factor as far as openness to vaccines, but also especially with COVID, given that age is a factor as well.
That can be very powerful, the narrative of elders in the community who have lived through that, and then showing the consequences of it. I guess my thing is, clearly, health psychologists, including psychologists at Auckland Uni, I think possibly Felicity Goodyear-Smith and others, well, she's a, I don't know if you call her health psychologist, but she's been involved with meningococcal and vaccinations, and clearly it hasn't completely worked, has it? Because there is a strong component of the anti-vaccination movement here in New Zealand. I think it might be, I've heard figures of maybe 4%. That's a concern. Clearly what we've done in the past, I'm sure has had some effect, but there's going to be a group out there who are not going to really be mitigated that well. So once these outbreaks happen, my question is, I mean, what can we do as health psychologists to try to quell these fears? Because it is going to look like a crisis of confidence, isn't it? It's going to look like, oh, these health professionals, they don't know what they're doing. Look, this kid got a vaccine and now they're sick, or all these people got sick from the vaccine, when in fact, and it will take a little while to investigate the case as well. And when the media jumps onto it, then you could get a lot of people not getting vaccinated who really, there's no real good reason not to get vaccinated. And that's a real concern.
One thought which I have about your question really is that perhaps in this kind of situation, it's often stories which are much more powerful than statistics. And certainly if you look at what the anti-vaxxers do, then a tremendous amount of what they do is about the individual stories of individual people, and putting those out in a way which actually sort of makes it seem like they're much more representative than what they actually are. So perhaps one of the things which as psychologists and as other people are hoping to make this work better, it's going to be actually making sure there are lots of the stories about people who get sick and then get well, and those kinds of stories as well, so showing that actually, yeah, as with other vaccines, some people may feel a bit out of sorts for a little while and then get better, or some other people may in other ways have some impact, or that it may be the kind of thing which you're concerned about, where it's unrelated stuff which people are seeing.
Yeah, well, when you're vaccinating so many people on any given day, particularly when you're starting with the elderly, on any given day, a certain number of elderly people are going to die. And it's inevitable. Someone's going to get the vaccine and die that day, and then boom. It's probably going to happen a lot. And so I think what you were talking about the stories are very powerful. And stories from community leaders, from trying to get onto a micro level. For example, in Maori communities, they're leaders, they're respected elders, respected figures within youth, popular figures. That can have a powerful impact. I assume something like that's been used before, though, in terms of trying to get people to vaccinate their children. But again, it hasn't worked completely, has it? I mean, there's always going to be some that don't do that. And then it's scary if somebody gets vaccinated and they suddenly die. It's going to create, we're inevitably going to have the media jumping on this. And it's going to be important, I think, to think ahead in terms of how this narrative is cast. Like, oh, yes, well, yes, 2 people did die today in the United States right after receiving an injection, but, 168,000 people were injected today, and they were over the age of 80, and some statistical figure, obviously I'm just making that up, but some statistical figure there to try to put it in perspective.
I have a question, if I may jump in. And I'm thinking about it from the perspective of agency, whose agency it is to help to solve this problem of mass psychogenic illness. Is it health psychologists or is it media? And should we try to create narratives which media could use to kind of mitigate this problem? And the second question I had is about the contestation of power, because obviously anti-vaxxers, they get more power once they perceive that they are not heard. And perhaps they also need to play a role in a dialogue to break this further conspiracy theories. So that's 2 ideas which I'm kind of trying to think of.
Yeah, that's really interesting. And you know, when you say the mass media, and then you got social media, and nowadays people subvert the mass media and social media. So we just don't have the mass media to convince or to present to. You have social media, and we know how social media, things just, it's a wildfire.
Yes.
Right? It just spreads like crazy with 5G in New Zealand. I mean, they're burning down the towers. I mean, do you try to approach people like at Facebook and other social media outlets? I think it's important to think ahead before this happens, because all of a sudden it's on us. How do you deal with it? I see this as inevitable, and I see this as it really is the perfect storm. There's tremendous potential for just widespread wave after wave of outbreaks. You got different cultures, different countries, social media now, mass media, and trying to mitigate once this happens. So maybe having a dialogue with some of the media organizations and saying, look, for example, in New Zealand, we project that this is going to happen. It will happen. Somebody is likely to be injected and pass away within 24 hours. And so how are you going to cover that as a story? It's certainly going to raise concerns, but then you've got the other issue of, in the year 2020, people just subvert the media and go right to social media, conspiracy theories, and that's another one. I mean, perhaps a website that is created ahead of time to try to, that people can go to, and it addresses some of these potential arguments that, okay, what are the statistical odds of this happening? Or so we can try to reduce the impact, because the impact is going to be real world, isn't it? If people don't get the vaccine, now we're assuming it's safe and effective. If people aren't getting the vaccine, then, or giving it to their relatives who are under a certain age or over a certain age, then people are potentially going to die as a result of COVID-19, right? And not the vaccine. So what do you think about, like, how have people done this in the past? Have they mitigated with websites? Do you know?
I had a thought about suicide and how there's been concerns in the past about, you know, how you share with people about suicide and kind of the copycat effect. And then one of the ways of mitigating that was, you know, rules, different countries, laws about what the media could and couldn't share. And then now I know that in New Zealand, for example, there are specific laws about what the media can and can't share. And I think that's quite unique because there aren't many topics in which the media have those kind of restrictions. And if we've never been before in a time where the whole world's going to be using the same or similar vaccines, this might be a new precedent like suicide, for example, where we might need to have some rules. And I don't know how they apply to social media, but my understanding is that there are some rules about what you can and can't share relating to suicide and how, you know, glorification of suicide has got some issues. But then we came up with the movie 13 Reasons Why, and there were discussions around that. Anyway, I think maybe learning from what we do about suicide, maybe there's some lessons to be learned there. And also I know that with the anti-vaxxers, a lot of the concern is about, you know, big pharma and who's making the money. And you mentioned before things about even if people thought they were getting it for free, that they were hesitant. But I do wonder if there's a way for governments to make it quite clear that no one in particular is benefiting from the money, and that might squash a lot of those concerns around the conspiracies themselves.
That's a really good idea, I think. Very interesting. it's something where, you know, it's kind of like watching that hurricane coming in the United States. You can see this thing coming. You don't quite know who's going to get what where and how it's going to hit. But I think it's an inevitable issue that we're going to have to face. And that is, once it does get here, and once the vaccine is, and then of course there's going to be multiple vaccines. And if it was just one vaccine, it might limit it to a certain extent. But the fact that there's likely to have different vaccines, it's going to even create a more challenging. But I think, look, this is what health psychology is about, isn't it? It's about challenges. It's about trying to really have an impact where you could help a lot of people and potentially save lives. And to me, that's the exciting thing about health psychology. Even though I'm not trained in health psychology, I have no background in this area, but it's a really potentially rewarding area because you can help so many people and really make a difference. And I think with this here, there's people looking, I'm sure, at how to get a higher uptake of COVID-19 vaccinations. What I don't think a lot of people have probably thought about at this point, maybe I'm wrong, is the likelihood of these mass psychogenic illness reactions and the potential that these reactions have in undermining authorities and dramatically potentially reducing the uptake of the vaccine.
Seems to me that one of the really interesting things about this whole situation is that if we start off from the assumption that your mass psychogenic illnesses are an anxiety-driven kind of a disorder, one of the things which we're needing to do with this particular situation is actually to balance the anxiety in the situation, which means that people actually do what they need to do by like getting tested and you know, maintaining their own safety and so on, versus the kind of anxiety that you're talking about, which is driving the mass psychogenic illness. One of the ways which from a health psychology point of view, we might well look at trying to deal with that situation where you've actually got a balance on is making sure that people have stuff that they can usefully do to actually look after their own health and actually in some senses perhaps reduce their level of anxiety a bit by actually knowing that there are things that they can do. So it may well actually be that part of the thing is helping to ensure that people have other stuff that they know that they can do, so it's all a little bit less scary and therefore they're less likely to get tied up in the unhelpful aspect of that anxiety.
I think, you know, you're looking at three layers here. You're looking at the mass psychogenic illness. I think you're looking at mass psychogenic illness by proxy. And then you're going to see in older children and in adults as well, the redefinition of mundane aches and pains as COVID-19 related as well. So you've got all these different elements involved here, which are likely to exacerbate this. And it's a real challenge with the media, isn't it? With the mass media, with the social media, and just with the mess the world is in 2020. I mean, all this that's going on in the United States and all the mistrust that's out there with governments. I mean, we have, I don't know, I've only been in New Zealand 11 years. I love the country. I now have citizenship last year, and I'm very happy about that. But look at just the other day, they had a protest in downtown Auckland with 150 people. They protested wearing masks on their individual freedoms. Most of them weren't social distancing. And so this is after all of the advice given. And I think it's quite frustrating because other people are in lockdown, and it just goes to show to me the level of distrust out there that, and I think they're a tip of the iceberg. that group there. Yes, they went out, but there's a lot of others that have. There's just so much distrust out there, and so much information on the internet, and people aren't sure how to evaluate information, are they? I mean, that's one of the things we teach in school is, you know, how to vet a website. I in Invercargill, and you're getting health advice website. So, you know, we have all these challenges, and I guess that's what health psychology is. I mean, that's why you're a health psychologist. You're here to try to make a difference and try to somehow mitigate potential impacts that we see is about to happen.
I think maybe of interest could be also talking to general practitioners or specialists who encounter people with fears of vaccine, and also maybe preempt them of the usual individual frames of why people find it scary or risky, so they're educated to give an advice on bust the myths of conspiracy theories.
That's a really, I think that's really potentially worthwhile. And also, I guess identifying certain social influencers, because that's a big thing now within certain demographics. And I suppose people like Dan Carter or Richie McCaw or something like that, that has a certain demographic that look up to them. Although I think with Richie McCaw, it didn't work too well with the flag, did it? He was saying we should have the new flag, and we didn't have the new flag, and kind of fell flat there. But I mean, it's that's an interesting thing, is to approach physicians. Do you know if that's been done with vaccines in general to get a higher take-up?
Not quite sure.
I do know there are a small number of physicians who are skeptics, which is a concern. And then I mean, there might be some groups that are opposed on religious grounds. I'm not sure. I mean, that's another area to potentially look at as well.
Yes, because I think for physicians in particular, there might be some prejudice against anti-vaxxers as well. So they might have less treatment or less compassionate treatment, or not being heard, which kind of exacerbates their fears or confirms their theories that the medicine is against people.
I'm wondering if the anti-vaccine community, I mean, they would be networked well, and they would probably have a group of doctors who they would be more inclined to go to, like a small group of doctors that might support their position, and they might be more likely to go to them as opposed to the general GP. So that it might have a less of an impact there because of that. But yeah, it's interesting. I mean, Ashley Bloomfield gets on TV and talks about the importance of wearing a mask. The Prime Minister talks about the importance of wearing a mask. And then you got 150 people marching in downtown Auckland, not social distancing, and most of them not wearing masks. So you're always going to get a segment of the population, aren't you? It's just a matter of what proportion that are not going to follow. But here, the interesting thing to me is, I mean, you've got adults who are making decisions, often for parents, saying, okay, well, I don't want my child vaccinated. Okay, but what risk are you presenting now to your child? Because that's an issue as well, isn't it? And that's an issue for government, I suppose. What age group should you make vaccinations mandatory? And of course, Australia backed off that really quickly. So that, I'm thinking, is probably not going to happen here, and they're going to make it more voluntary. So as a result of that, that's where really the health psychologists can make an impact, right? Well, can I just ask, so Goldie, what's your background?
I have a bit of a varied background, but I did my master's in health psychology in the department, and I happened to see this email and I was like, oh, it's on Zoom, I can join, because I currently live in Tauranga. But I manage the Anxiety Helpline, which is Anxiety New Zealand Trust's national 24/7 helpline. And yeah, I have a background more in health type stuff, but made my way into psychology, and now I manage the helpline.
That's really interesting. And what about Alina?
I'm also a medical sociologist by training, and I particularly looked at media and communications for mental health.
Right, and that's a big area, isn't it? The media, social media, mass media, and the influence they've done. I think Kate McCrill has done some work on that with generic medicines, which you're probably maybe familiar with. I think he worked with Keith Petrie on that, and I think that's her PhD, possibly. That's really interesting. And what about Malcolm?
I'm a clinical
I don't want to put you on the spot here, Malcolm.
I'm a clinical psychologist in private practice now, but with a long background both in working in the physical health area, and quite a long association with the health psychology program also, including supervising a lot of interns and so forth.
Okay, that's interesting. Is anybody else that would like to, I don't know, ask a question?
I think we might leave it there, Robert, but I'm sure if people have queries for you and want to ask further questions, would you be happy for them to email you?
Yeah, look, sure. I'm happy to answer any emails. Look, this is the first time I've ever done a Zoom presentation, and I had the text underneath the power. Yep. So it's a little bit awkward here for me, but look, I really appreciate everyone turning out. And for me, I guess it's that question: how can the Auckland University Department of Health Psychology try to have an impact on this area? I think a lot of people are looking at vaccine, getting people to take up the vaccine. So that's being well researched in the past, and people are looking into that. To me, I'm looking at mass psychogenic illness and potential impact there. Yeah.
Okay, well, thank you, Robert. It's been a really interesting talk, and really enjoyed hearing how you've pulled this history together as well. And I think it probably is going to lead to people thinking more about this area and how we can potentially do some more research. So I suspect you might get some shoulder taps for some collaborations that you might end up being inundated. So thank you very much. For those of you that have watched us online, thanks for tuning in. And we'll make this available for people that weren't able to attend today. Thank you.
Okay, look, thank you, and take care.
Thank you.
Thanks a lot.